for this sort of work in place here, so that we can understand where these models might fit in. Okay, so here we go. I'm going to be, this talk really is kind of two pieces. The second of them will occur after the break. First, I'm going to talk about sort of motivations and give an overall characterization of systems science, sort of what it's trying to accomplish, and talk about dynamic models, these simulation models that we've just glimpsed at sort of an ad hoc way. Then after the break, I'm going to be talking about several types of system science methods that have relevance, particularly in the context of the neural-relational framework. So much of the work that I undertake is motivated by what my colleague Bobby Milstein, previously of the CDC and now doing work with the Riddle Foundation, refers to as the fact that public health seeks to redirect the course of change. And, you know, I could put up any number of slides here showing indicators of sort of public health that for a while were yielding positive gains and then started to yield what people increasingly call the crisis. This is a particular example is from sexually transmitted infections in Canada, but it brings to the fore many questions that cut across areas of public health. You know, what's going on here? Why do we see this pattern over time? Why do we see this apparent reversal, decline in reported cases of the sexually transmitted infection, then rise? Is this good or bad news? Many people call this a crisis. We're seeing, reported cases that were at unprecedented historic levels. But then some people said, well, is that a bad thing? Maybe we're just more effective at finding cases now. Maybe it's actually a good thing. Maybe it means we're doing our job more and more effectively. Maybe it's not a sign that there's more cases of infection out there, just we know about them and we can deal with them, we could treat them more quickly, etc. And second and thirdly, how can we bend this curve? How could we improve things, change things for the better? These are questions that cut across areas within public health. But the fact is, in public health, we're dealing with issues that are complex, that are tangled, involve tangled issues, often cross-sectoral in nature, that involve a whole bunch of factors, sometimes related to biomedical components, all the way through to cultural issues that are all linked together. And it's really difficult to sort of deal with these sort of questions within a siloed fashion where, you know, the behavioral and social science folks are over there on campus and the biomedical folks work here and the folks who understand the issues having to do with the epidemiology are located somewhere else. These are traditional divisions that are not amenable for addressing the problems. And if you look at many of the areas where system science has been applied, for example, in the obesity area where we've done work, and particularly in the areas of diabetes, what you see in terms of the actual narratives that people have, it's not biomedical. I mean, it may start with, you know, the doctor said my weight led to me getting diabetes. But when you really look at what lies behind it, you see these layers of narrative, these layers of meaning associated with it. And some of them relate to social determinants of health, the availability of a walkable infrastructure, the built environment, recreational facilities, food availability, rather than, you know, living within a food desert. Others have to do with the culture, the fact that sometimes people in the inner city bulk up to avoid bullying, particularly young men. There's issues having to do with sociocultural behavioral practices that are hard to change because they're so rooted in the culture. And you know, we see this in many areas. So when we actually think about the issues and we think about trying to improve things for the better, to reduce obesity levels, suddenly we're working with issues that cross these neat boundaries we establish in terms of our departments, in terms of our schools, in terms of our centers. And they start to yield these tangled sort of relationships that don't have neat classifications. So the role of environments, surely the biomedical components is part of it, but lots of other components involving multiple actors, consumers, retailers, agricultural producers, city planners, weight loss industry, shifting norms and people's changing beliefs about what is healthy food, what's a normal weight. All these things come to the fore. Similar issues with oral health. So I'm lucky to be doing some work with some folks in Neil Helfand's group at UCLA in the area of oral health. And here, too, there's a tremendous number of challenges associated with dealing with particularly childhood oral health that are, again, entangled with health service delivery, with cultural concerns, language barriers, particularly in an LA context, trust issues having to do with behavioral risk factors for sure, brushing teeth, flossing, and use of fluoride toothpaste, et cetera, but also many other factors in the background. Heart disease and tobacco, we could tell the same story, and Sandra Galea has a wonderful sort of rendition of this. And once again, we have this whole set of actors that have a role. And in developmental health areas having to do with childhood development, there's very big challenges that confront us with a similar set of entangled relationships. And, some of the questions we'd really like to answer: where to best invest public resources? Screening, greater volume of caseworkers, co-location of service facilities, improved intervention efforts, training methods. These are all different ways of investing in a situation, and getting some sense of what the gains would be by each, and importantly, how soon we'd expect to see those gains, so we don't shortchange the program before it even has a chance to show effect, can be very, very valuable. How do we quantify the deep but diffuse and cross-sectoral and both proximal and distal gains from interventions in early childhood? I think we'd all agree here in the room that an investment in early childhood mental health probably yields incalculable benefits, over the life course, not just for that person, but for their family relations, for their children, et cetera. But traditionally, it's been hard to get a handle on how do we quantify that. And for the bean counters of the world, of which there are many, in case you haven't noticed, they want to see dollars and figures. How much is this going to cost, and what are the benefits cost-wise? And that's hard to do. It involves so many different factors that with traditional methods, we have a very difficult time totaling these things up. How do we effectively coordinate the contributions of diverse allied health professionals who are involved in this? The PTs, the OTs, the speech therapists, the folks involved in the social work side. How do we mobilize those actions and get them to coordinate most effectively in terms of the case handoffs, but in terms of sharing information? What's the best place to place a new service location in the context of shifting populations and migrant populations? How can we identify and prioritize collection of cross-sectoral information that matters most? I heard last night, wow, there's real challenges to sharing information cross-sectorally. And sometimes even within the context of one environment, one particular information system, because of HIPAA constraints, only some clinicians have access to information, other caseworkers don't. So this question about what information would be most valuable to get allows us to put our limited energy into things where it pays off the most. Perhaps proactively flagging cases that are likely to develop with particular risk in an adverse direction. And how do we address and coordinate these macro and micro concerns? So there's been many aspects of the neurorelational framework that have inspired my thinking on this work, but this particular slide from Connie's book I thought was particularly apt in this context, where we have many micro-level issues having to do with memories and meaning making at the developmental level for a young child, aspects having to do with the sleep and awake cycle and nutrition. But it's tied in with service delivery issues having to do with child welfare and mental health and developmental disabilities, medical needs for sure, but also early care, early child care and education. These macro level issues that shape funding and availability of services and accessibility of those services interact with these micro level factors. And if we think about where to invest most effectively, we need to consider the multi-scale, the multi-level aspects of this situation. And, here are many of the factors that come out here: developmental schedules, diverse actors, for sure, diverse organizations in critical periods, dynamics of relationships at the micro level, something that was looked at by that model. But at the same time, life course impacts, these long shadows that are cast over decades and that relate to the ability to care for the next generation of children, for example. And, within these areas, we've had great success, profound success, and very valuable success that's occurred at the level of traditional methods. So traditional scientific inquiry has tended to be quite reductionist in its attempts. It takes things apart and figures out how the pieces work. And that's really valuable. No question that provides foundational knowledge. But it's not complete. It's not a complete strategy for insight that's actionable in terms of priority setting, in terms of evaluating investments. There's areas where it's given profound benefits, but doesn't address too much, our needs in terms of assessing policy priorities, to reason about the effectiveness and the cost effectiveness of different investments. It doesn't help us that much when we're dealing with the syndemics context, where we have health conditions that interact, that are entangled at the community level, mental health and substance abuse and domestic violence concerns that are linked together, and where dealing with one really can't be that effective without dealing with the others. Traditional ways of taking things apart into pieces gives us a great knowledge about what's going on at the more basic level, but little understanding of how it fits all together and yields the results. It's kind of like you could be the world's best car mechanic. You could be an expert in all sorts of engines and drive systems and axles of cars, but you know very little about traffic jams. It's a different level of issue. Understanding those pieces, as useful as it is, doesn't make you a city planner in terms of planning traffic, because it's a different type of concern. It's a concern that results not from those pieces in isolation, but from those interactions between them. It doesn't make you give you the immediate ability to plan, repair schedules for city buses. So, here we're trying to arrive at fixes that stay fixed, investments that continue to pay off, and where we can anticipate the timing of that payoff, so we don't cut them off before they've, cut them off at the legs before they've yielded benefits. So, we have these challenges, and traditional methods have difficulties in fully allowing us to address them. And this has been mapped out in quite some detail for certain sectors. So in the obesity area has embraced system science in a remarkable level over the past 10 years or so, and I've been fortunate to be part of those conversations in those NIH planning groups for this. So this is a map of the food system and factors related to obesity from Sandro Galea. Shariki Kumnaika from University of Pennsylvania has put together sort of maps of the different layered contexts that affect obesity, and others have mapped out the set of linkages, one factor to another, that relate to obesity and divided them into a bunch of different areas. And all of these are steps towards starting to think about a more systemic deeper way of dealing with the pieces rather than in a very siloed way where nutrition and physical activity are undertaken separately, for example. So in these contexts, we're dealing with a situation of cases where we have systems that are more than the sum of the parts. We're dealing with in system science with the science of the whole. And we focus on systems where the pieces knowing about the pieces is not enough to know about the behavior of a system. And instead, we see what's called emergent behavior. Do you remember that model I ran? We saw that clustering. We saw that it was it wasn't just that toxic stress was spread evenly all over the context of that network. Instead, it clustered. And it clustered for reasons, but that's an example of an emergent pattern. I didn't put into that model something that told it, achieve this clustering coefficient within that model. I didn't say, make it clustered. Instead, that emerged out of the basic rules. The fact that you have buildup of toxic stress that is partly dependent on the nature of your relations with those around you, and you're more likely to interact in a negative fashion if you have high levels of toxic stress, and that's likely to yield a blowback by those individuals. And so that tends to yield clustering, but it's emergent. It's not something we put in. And, the patterns that we see out of this are very different than what we'd see through any single component of the system. By looking at a car in isolation, you don't see traffic jams. To see traffic jams, you need to understand the interactions of cars. Traffic jams are an emergent property of the vehicle. And, here we have, in this context, a situation where when we try to intervene, when we try to change things in these contexts, we have ripple-through effects that are often surprising. We don't anticipate exactly what the nature of the change would be. And there's a long history in health of sort of inability to translate directly from a narrow understanding into a global understanding. So, for example, understanding caloric expenditure, the amount of calories in a certain in a sugar-sweetened beverage, doesn't immediately allow you to go to translate, what's the impact of banning sugar-sweetened beverages into reductions in weight. You can't simply translate it to energetically equivalent weight because it ripples through to other aspects of eating habits and to physical activity and sedentary behavior concerns. And as a result, you can't simply create an equivalence. We also see patterns, in many areas of health that are manifestly different than the pieces. It was noted first probably in the infectious disease area, this from deaths from bubonic plague in the 1700s or childhood infectious diseases, where we traditionally, before the advent of mass vaccination, had spikes in the number of cases. But, we see it too in the case of childhood mental health. We see it in the context of the interaction between caregiver well-being and child well-being. That sometimes, there's a co-regulatory capacity here by which the caregiver helps regulate the child's well-being and stress levels, but the child's well-being and stress levels, in as much as it can yield interactions that are less rewarding for the caregiver, can sometimes adversely affect the caregiver's moods and affects. And there's a vicious cycle that can be set up there. And, within the areas of health, we'll sometimes draw a system out, we'll call it a state space. We'll say, okay, a given child and caregiver dyad, a pair of them, will evolve in terms of their level of well-being over time. So maybe we make an intervention where initially their well-beings are each fairly adverse. They're fairly low levels of well-being. And by judicious investment, by the sort of clinical care that Connie's efforts are helping to teach through the neurorelational framework, we may get a situation where we improve the ability of the caregiver to respond effectively to the child. We help eliminate the toxic stress involved in that relationship, and you see both of them enhancing well-being, so going up on both scales to a new sort of stable point up there on the very positive side. So they're coupled together. One cannot be considered fully independently of the other. And an investment in one requires thinking about the other. So in these areas too, we see these key sort of factors that are emergent, where you have this coupling. There are also issues of tipping points. These are very well known from infectious disease area, where we try to achieve herd immunity. We try to drive a disease out of circulation, an illness, a communicable illness out of circulation, by make it unable to spread by vaccinating people. But you also see these in diverse areas. And the general opportunity here is that if we can identify tipping points, we can recognize that, if we could just affect things enough to a certain key point, all it would take is a little bit more investment, and we could see it go to an entirely new situation. We could shift, for example, this interaction between caregiver and child from a situation of adversity in a kind of vicious cycle of depression on the part of the caregiver, rippling through to lack of response on the part of the child and lack of warmth, but in the relationship, we can shift it to a situation which is equally stable, strong and robust and resilient up in the upper part of the diagram there. This is the opportunity that tipping points present to us. But if we're not aware of them, we may trip them the other way. And we, by cost-cutting and short-sighted administrative efforts, by siloing things, we may end up shifting that dyad back down to that other side, to the adverse side of the situation. In the developmental area, perhaps more than any that I'm aware of, we see what's called path dependence sometimes. The fact that where you are now depends so much on your history. And the effect of an early life insult, for example, absent attempts to remediate it, may really cast this shadow on your life course, affect your ability, your chronic disease load 40 years later, 50 years later. You look at the work of Barker in the UK, or some of our work in Canada with diabetes, particularly in our Aboriginal population, you see this writ large. It seems those key critical periods, periods associated with in utero exposure, periods associated with early childhood, have such a big impact. And to reason about that effectively, we need to reason about those life courses, about the dynamics of an individual's life. And we know that early investments can pay off over the course of a life, but to really reason about it well requires the sort of dynamic modeling we're talking about here. We also know and appreciate the role of networks. And I'm going to be talking about networks, particularly in the later part of the afternoon, and the way in which network science can help us reason through opportunities for investments that might be relevant for early childhood education. So it might help us recognize bridging individuals who could translate policies or practice, innovations in practice, perhaps applications of the neuro-relational framework from one sub-community to another sub-community, for example. Could help translate the gains from one subgroup to another. And I'm going to skip forward here because time is short. But when we're dealing with these complex systems, I've been talking about their difficult aspects. And what's really important is that, these things like path dependence and the coupled nature of the child and caregiver, the tipping points that are associated with systems, the heterogeneity that we see, these are not merely intellectually of interest. For those who are CSU faculty, these are not merely fascinating episodes for study, but they really matter in terms of making decisions that make a difference. And as I said earlier, making fixes that stay fixed, that don't fall apart, that don't get canceled prematurely because there's no way they could have shown benefit quite yet, but people didn't realize the inherent delays associated with them. So when we have a complex system like this, it raises real practical challenges. How do we learn from experience most effectively? How do we take something that worked in LA and translate it to Fresno? How do we take something that worked in the Canadian context and bring it into an urban environment in the southwest of the U.S.? How do we coordinate most effectively? I heard that writ large last night. How do you coordinate cross-sectorally in a most effective way? So you have the various allied health professionals and social service personnel that are involved in early childhood care. How do you get them to, instead of working at cross purposes, to work in a seamless whole, so that the investments made in one area of the system ripple through to the gains throughout the system? How do you make planning decisions in terms of possible improvements to the system when it involves all these tangled micro and macro level features? And how do you design a system? If we could step back and think about cross-sectoral sort of linkages and designs to make those possible, to enhance those, what would the best form of that look like? If we can't deal with these things effectively, often what we run into is what's called, in many quarters of system science world, policy resistance. It's a case where a policy, by its nature, is working against the nature of things. It's working against the nature of things. It's working against the nature of the world as it is. It's working at cross purposes with the way things are, and as a result, its effects are diluted, or even reversed, or greatly diminished. And there's many cases of this within the health area. I'm not enough of an expert to know in the early childhood context of cases, but I'll tell you they're writ large against many areas of health, whether it's tobacco-related disease, whether it's issues having to do with drug resistance and antibiotic resistance and communicable diseases. We are often in a situation where we fall out of one disaster and we end up in another. We try to respond to one emergency and we create our own fires. So, here, like King Canute, we need to avoid working against the nature of things. We need to understand how things work out there so that we're not butting our heads against it, and so instead we can navigate it more effectively. And to do that, ladies and gentlemen, is the province of system science. The general reflection here is the patterns we see in the world statistically, the outcome measures, the indicators that are collected, these things, ladies and gentlemen, they're reflections of some underlying processes that we'll often hypothesize about. And informally, we talk about things. We're not sure what's going on that we see this new data, that's come in. We're not sure how things work in this family after they're no longer in court-ordered contact with our caseworkers. We're not sure what happens to those children of the migrant workers when they shift between locations. Are they falling through the cracks? We're often hypothesizing how things work out there in the world. We're reasoning about the processes out there in the world in our heads. To really understand why we see the patterns that we do, there's a need to formalize that description of things out there in the world, how they might be playing out in the world. And this is not a matter of having a crystal ball. It's not a matter of being completely sure or paralyzed. It's a matter of using the model as a way of learning about how things might work in the world and more quickly spotting inconsistencies. So system science is what I call the science of the whole, and it's designed, ladies and gentlemen, to help us sort of reason about these cases where the whole is greater than the sum of the parts. It can help us visualize, understand, reason about the implications of how things work out there. If we hypothesize, we think this is kind of how things work, it tells us very quickly, is that consistent with the evidence? Is it consistent with the best evidence we have available for us? And a central way in which we do this is through dynamic models, these simulation models. These models weave together representations of our hypothesis concerning things out there with data from the world and can help us sort of take those together and understand what the implications are in terms of behavior we expect to see and in terms of possible counterfactuals. So these models represent sort of how things might work. And I use the word might. Again, this is not putting your faith in a model. It is correct. It's instead advancing some hypothesis in an operational way that's more effective than just thinking about it in our head. So they serve as these thinking tools, these labs for refining our thinking and helping share our assumptions with others. There's many features of situations that advise the systems approach, and I've just talked about a lot of them. I've given you a sheet as part of your handouts, and they'll soon be on the website. I'll do that during the break, that sort of highlights things to look for in the system science area. People often come to me with problems, and they say, I'm interested in this problem. Is it a good match for system science? And a lot of the times I point them to something like this. I say, well, let's talk about your issue. If it doesn't show the sort of, that some of these features that we have up here, it may be that you don't actually need system science approaches. I'm not here to sell system science. I'm here to sort of talk about how it can be used to deal with the issues where it seems to be most needed. And these are some of the flags that I look for here. Those are in your handouts. I don't have time to go over them more right now, but I'm happy to talk about them in person. So what are these dynamic models? Well, these help us represent hypothesized causal relationships regarding factors in the world. They provide a way to examine the diverse system-wide consequences of a change here as it ripples through the system. So when I enhance the ability by clicking on that person, I enhance their ability to self-regulate. That rippled out across the system. It started to affect their stress levels, but also how they interacted with others. And that affected how other people's stress levels, which decreased the likelihood the others would be agonistic in their behavior back. And as a result, over time, it rippled through the system. And these sort of models help us recognize vulnerabilities of a system, leverage points, places we might be able to make a particular effective difference, ways of changing system structure, and ways of effectively working together. These things go by different names. And one of the challenges for anyone hoping to come up to speed in this area is the fact that these models go by different names in different subfields. So sometimes they're called mathematical models. Sometimes they're called causal models, which is confusing because there's a sort of parallel and very valuable train of causal modeling in the statistics area that's admirable, but is a separate type of causal model. Sometimes they're called mechanistic models, models of the physics of a system. They go by different names. But fundamentally, they try to depict the processes out there in the world, not merely observables, not merely just one or two latent variables, but sort of how things are working out there in the world in terms of a variety of factors that are involved in the process. And they simulate the step-by-step evolution of the system over time. So they have maybe many people depicted, and they depict my interaction with you and your interaction with me, and me saying something nasty to you and you responding in kind and increasing my stress levels. They help us sort of simulate over time how different people in the system, all across the system, are evolving together in their interactions. And because they aspire to capture our hypothesized causality of the system, sort of how it works, they're designed critically to look at reasoning about counterfactuals, reasoning about situations we haven't seen before, and maybe we could then actually observe empirically, maybe because we launch an intervention, maybe it's because we undertake some controlled experiment, and we can compare it with the results of the model and learn more quickly whether or not the model is capturing, learn where in our understanding the world things might need to be improved. Okay, so these sorts of models are extremely common in certain walks of life. People have been using them for decades and decades in certain domains. Pilot decision-making, flight simulators. Many of you have probably played way back in the day. There was Microsoft Flight Simulator, and then, since that point, it's gotten more and more rich in terms of what you could do. Many of us grew up with driving simulators, right? You drive down those roads. I remember one student in my class, the driving simulator class, he was from Southern California, and he said, I recognize that highway. That was the highway by my town. We use simulators to learn how to drive more safely, not out there on the road, but with the simulated system before we went out on our own on the road. And similarly, these ideas, the models can help you refine your thinking, help you refine your gut feelings for the system before you try something on real people. Okay, so these models, far from being sort of a crystal ball, a black box you put your faith in, they're a way of improving your mental model. You're sort of understanding the situation, and they're tied in with this process of describing a system, simulating the consequences of those assumptions, using those results to refine your understanding in your head about what's going on, and then observing, maybe undertaking actions or undertaking new data collection prioritized by what you've observed from what's sensitive in the model. You observe things from the world, and you further refine your mental model. So this is part of a sort of a learning process, and it's a process of learning that can take place more deeply, more quickly, and more comprehensively because we have the models together with the empirical data. Now, colleagues of mine have aspired to try to list out a comprehensive set of uses of these models. And those who have aspired have found dozens and dozens of ways that these models can be fruitfully used. Don Burke, Dean at School of Public Health at Pitt, and Josh Epstein at Hopkins are two folks that have sort of cobbled together dozens of uses of models. But some of the most important I put here. Making explicit our mental model so we can discuss it and collectively refine it, to aid learning so that we can learn more quickly from the evidence. This is not a matter of evidence, real-world evidence, or the model. It's a matter of model making sense of real-world evidence, helping us to think through the implications of the real-world evidence more quickly. And also these models can help in management of complex systems, serve as what-if tools to identify desirable policies are cost-effective, high leverage, or robust, evaluate benefits of restructuring a system, rejigging how things work cross-sectorally, perhaps in the context of Fresno County, to help understand trends, make sense of the interactions, the diverse processes. I showed you, one of my first slides showed those decreasing case counts and then rising case counts. Models can help us ask that question, is this a good thing? Is this a bad thing? Is this something we should be alarmed about, or is this something that we need to actually celebrate? They can help us prioritize research and data collection by pointing us to key uncertainties that make a disproportionate impact on which strategy going forward might be most effective. And they can help us understand contexts in which certain strategies are best applied. Can we take that intervention aimed at early childhood dental efforts within LA, and it doesn't make sense to translate that in its existing form into a rural context. What might it need to be adapted? And finally, and this is very importantly, and I'll be emphasizing this afternoon, they can serve as really potent communication mechanisms. Mechanisms that can deal with community members, can deal with folks from wide walks of life, and help bring forward a collective discussion about possible futures, health futures, for communities, for groups, etc. So what do these models look like? Well, they depict the behavior of a system over time. So there's evolving state. The model, every person in the model is evolving. Some of them may eventually emigrate or die. Some may be born. But there's an evolving state consisting of all these people in the model, each being in some status with respect to pregnancy, with respect to job status, with respect to their family environment, etc. And the model's evolving that over time. The models specify incremental changes given the current state, given the state someone's in. Maybe they're in a pregnant state, it will relate some rules for, okay, at what point will the delivery occur? Or perhaps an individual's in a state of interaction with another, it will dictate the rules for when the interaction will take place at very specific times, how I'll respond to your interactions with me. System behavior here, the behavior of the system of a whole, say how many people have chronic diseases or due to allostatic load or the level of toxic stress. That's not something I put in directly. I don't tell it, assume this level of toxic stress now. Instead, that emerges from the system. It emerges from these interactions that are going on. So in contrast to, so I use regression models a tremendous amount. I do survival analysis as well, and competing risk analysis, and applied biostatistical models and computational stats a great deal. And sometimes we apply models that are explicit temporal models in the context of statistics. And I impose some functional form for the model describing my sort of the evolution of some dependent variable, and I regress the model against it as a function of time. But this is very different. Here, we don't know what the model's going to give us in terms of its behavior over time. It results from these interactions, just like a traffic jam results from lots of decisions of individual drivers for how to slow down when going around a curve, and under what conditions they'll speed up, and their visibility and the level of comfort they have with the pavement being wet, etc. So system behavior here, like behavior in the world, is emergent. And model behavior over time cannot just be pre-specified in sort of some closed form according to some exact formula. Because the underlying systems exhibit what we call non-linearity, the models do as well. And one of the implications of this is that, like the system out there, the behavior of the model as a whole is different than the sum of its parts. If you take two interventions and you evaluate the gains from each intervention, intervention A, intervention B, in isolation, and then you consider the results of combining them together, you may see results that are greater than or less than the results of the sum of each in isolation. There may be synergies, and they may work together extra well, and therefore they yield collective results that are way beyond any one of them in isolation. Or they may work across purposes. You rob Peter to pay Paul, and they don't work together well, and as a result, the net gain is a lot less than you'd think. You can get either one out, and models provide ways of interacting with that. Models, like maps, are abstractions. They're abstractions of the world. And like a map, we don't look to one map for all of our purposes. If I want to go to LA and I want to drive through it, I will use one sort of map. If I want to go to LA and I want to use the transit system, I'll use a very different map. If I want to go to LA and I want to reason, and I'm a hydrological engineer, and I want to reason about flooding risks during the Santa Anas or what have you, I'm going to use a different map for that. It's going to be topographic. And all maps are simplifications of the world. They abstract away from lots of details. You will not find every blade of grass on that map. And if it did depict it, it'll be useless. It couldn't fit in our car. Siri couldn't tell it to us. Watch out for that blade of grass ahead. It would not be useful. It's useful because it abstracts details. And models, like maps, are specific to purpose. We build a model for a purpose, for a certain set of questions, and what model we build will be different for different sorts of questions. They will tend to omit certain details. George Box, the eminent statistician, once said about statistical models, and the same is true for dynamic models, all models are wrong, some models are useful. And so it is with maps, right? All maps are wrong in the sense that they're not a depiction of the full world, but they're useful in part because they're not a depiction of the full world. They allow us to do things we'd never be able to do with the world. With models, you have to realize they are specific to your problem, to your context. And one of the key questions along these lines, and I'm going to be finishing up here, what's capturing these models? For these dynamic models, there's going to be certain things that it calculates. For example, toxic stress emerge directly from that model due to the interactions with the certain aspects of the environment and with other people around us. Whereas there were other things that were simply told to the model, assume a certain threshold for stress by which it turns into toxic stress. So these things that are calculated by the model, we call endogenous things. These are things that the model is generating for us over time. There's exogenous things where we tell it, just use this certain assumption. It's pre-specified in the model. It's represented in the model. It's there in the model, but it's represented in a fixed way. Fixed in the sense that pre-specified. It may be varying over time in a pre-specified way. Or it may be just left out of the model, hopefully consciously ignored. We chose not to put in the model because right now our model's more focused on that. We haven't had time to put it in. We want to think through the implications of a subset of things before we add this extra thing in. And it turns out that capturing more things endogenously up there at the top, generating them, has more flexibility, investigative power, and accuracy often, but it does require more time and resources to ground it. Okay, so key take-home messages. Addressing many of the larger health challenges we see in the infinite mental health area is especially hard because they exhibit features of complex systems. Things are tangled. Things can't be taken apart neatly and dealt with in siloed ways by academia. System sciences provide us with tools to represent and reason about the behavior of complex systems. These are tools used by cross-disciplinary teams. You need the social scientists. You need the folks from the public health side or community health side or systems or social services side, depending on your problem, different sets of individuals. But they're models that help us reason about the different areas in complex systems, which often include micro and macro factors. And basically what these models capture is dynamic hypotheses about the processes that underlie the behavior we see in the world, that underlie empirical data, for example, to which we have access, or our observations about a system. And they help us understand how diverse factors related to health disparities or to early childhood education combine to yield observed patterns, why we see these patterns, and they help us to reason about intervention effects. These models are specific to purpose, and it turns out that multiple and hybrid modeling techniques that we'll be talking about next, in our next session after the break here, will be very, very helpful for describing diverse sets of complex health challenges. So after the break, we're going to be talking about different flavors of models, because you're going to use somewhat different flavors to describe health services needs than you will for, say, needs reasoning about social determinants of health. And you can combine them and mix them and match them, but it's good to understand what tools are out there because they'll really simplify your life to use the right tool. Okay? So that will be after the break here, which is, I guess, in 15 minutes, 10:30. Yeah. Great.